any additional ways to stimulate hair growth post-follicular unit extraction? I had 1,500 grafts at the end of July, and my hair is growing, but only certain hairs. I was wondering when I will see growth in the areas between these seemingly dominant hairs. And what can I do to help? I've been using Rogaine for a month now, with no result yet, as expected. Not sure if this matters, but I wear a hat a lot. I know that I am probably jumping the gun by asking this so early, but any comments will be very welcome. Best regards.
Thank you for your question. It has been about 4 months since you've had your hair transplant, where you had gotten 1,500 hairs, and you're expressing your concern about the growth in between some dominant hairs, and that you've been using Rogaine, and it seems that you're just nervous about where things are going or whether things are going well. So, first of all, in hair transplant surgery, there are a lot of factors to understand when it comes to the anticipation of the amount of growth that you will have. But simply stated, this is still very early in the course of your hair growth after a transplant. In my practice, even with a lot of the advanced methods and hair regenerative technology that we employ, we still say that the full result is closer to approximately 1 year after the transplant. So let's understand some of the things that are happening. First of all, when hair is grafted, in other words, when it's taken out, whether it's FUE method or strip method, you're literally taking the whole plant with its root and placing it in another place. Now, when this happens, there's something called shock loss that happens. Now, shock loss can describe the impact of the effect of this swelling trauma of actual surgery resulting in shedding of part of the hair, but the root of the hair, or the dermal papilla and the complex around it, is intact. So therefore, after that shedding of the hair, and this can apply to both the grafts as well as existing hair that is adjacent to the areas where you had the transplant done, that can result in an area looking even more bare than it was prior to the transplant, and that naturally makes people nervous. In our practice, one of our standard approaches to helping minimize that transition phase has been the use of hair regeneration technology, which we developed, combining a material called extracellular matrix derived from pig's bladder and platelet-rich plasma. What the idea is that with advanced wound healing technology, it appears from our clinical experience that the hair grafts tend to heal a little bit faster, and the results start to seem to kick in, or you start seeing growth a little bit sooner. In addition, it appears that not only are we protecting the existing hairs from the shock loss or telogen effluvium, but in addition, it appears that we are also helping these thinning hairs become thicker. And that's a real big distinction when it comes to hair transplant surgery. Hair transplant surgery ultimately is limited by the donor area in terms of the number of hairs you can place, as well as the area that is being treated in terms of how fast is the existing hair going to thin out. So when we look at somebody for hair transplant, clearly that is a dominant thought, and what we've been able to do with hair regeneration is address that, I think, very successfully. But as far as your question is concerned, I think it's very important that you speak with your doctor or speak with the staff at your doctor's office. This is one of the most common concerns people have. In our practice, we see our patients very frequently, understanding that even though we know that full hair growth will not occur to its fullest extent, I should say, until about a year, it is very important that what we do is we see our patients pretty much every 3 months minimum, and the door is always open for them to come anytime within that time frame. But we will also do microscopic examinations, and we will see how things are progressing so that the patient understands that this is a natural process and that ultimately the success of the surgery will be determined at approximately 1 year. So for now, I think it's fine that you are using the minoxidil. There is some evidence that minoxidil topical will help move things along or help resynchronize the hair growth cycles. But understanding that throughout this process, there are going to be hairs that shed and hairs that start to grow in until you reach this kind of equilibrium somewhere at about the 1 year point. So I wish you the best of luck. I hope that was helpful, and thank you for your question.